Assalamu alaikum. Today I am here to explain what basically OSCE is, because mostly 90% of the medical students really don't know what OSCE is and why do we have to perform and how to perform, what are the common failures of OSCE, and how we can ace the OSCEs or improve the OSCEs. So I would like everyone.
Take notes. This is very important.
Very important.
Information. Very
Yeah,
important.
please be interactive. If you have any question, please ask me.
Yes,
I'll
yes,
answer.
You have PMC here.
Yeah, I'll try to answer. So, anyone, do you know what OSCE is? Anyone? OSCE stands for basically. OSCE stands for Objective, Structure, Clinical Examination. Objective, Structural, Clinical Examination. But as the name suggests, it's objective, not that MCQ objective. It's objective to assess your abilities, how you assess a patient or how you summarize the patient. Okay. So, an objective structured clinical examination competence in which the components are assessed in a planned and structured way. If you haphazardly do the OSCE or perform the OSCE, you don't do it in a planned or proper way, then the OSCE will not be accordingly. Because most common error in the OSCE is that the performers or the physicians think that the examiner is asking for diagnosis. Examiner does not need to know the diagnosis. He or she is checking the pattern, the way you take the history or you walk in, your body language, your communication, your practical skills are basically assessed in OSCE. What are the uses and objectives of OSCE? The first usage is to accurately assess the clinical criteria. Like we assess the central nervous system or anything. So over here, we need to know that the patients are not the real patients. The patients are dummy patients who have complete knowledge. They are assessing you. So the examiner is in front of you and at the behind of the curtain as well. So you are visualized by basically 2 to 3 people at a time. You have to assess all the things in a periodic manner, in a proper way, so that you don't miss anything. Because if you miss anything, you will not be marked correctly. And then second thing important in OSCE, which OSCE is checked, is communication. How you communicate with the patient. If you are not easy with the patient or you are not assessing the patient correctly, if the patient is like if you are very strange to the patient or in an angry mood, so you cannot assess the patient properly or he will not be able to give you the proper history. So you have to communicate the patient in a free manner so that the patient is easy enough to communicate with you. And then lastly, the practical skills. What are the 5 tips to ace the OSCEs or the world best OSCEs? What are the 5 tips? Number one, always learn from your previous OSCEs. If you don't learn from your previous OSCEs, your next stations, because in any exam you don't have single station. Does anyone know how much stations in NLE2 or NEB2? 20 stations. 20 stations. Kindly note it down. 20 stations. Do you know, Harish, do you know the subdivisions, how the 20 stations are divided?
Compulsory, huh?
There is no. There is.
Please.
Yeah. There is medicine station. There is according.
How many stations are related to medicine?
9.
7 stations are related to medicine and applied medicine. And then,
Surgery.
yeah, please.
Seven surgery.
7 surgery.
And then the rest is like the minor subjects, gynae, and then.
Yeah, 7 medicine, 7 surgery. 7 medicine and 7 surgery mean that in medicine, the related subjects, psychiatric medicine, neurological medicine, and any medicine type you can, emergency medicine, all cases are there in medicine. And surgery, orthopedics, and general surgery, different cases will be presented to you. And then we have 1 station for gynae and 2 stations for ops and gynae and 2 stations for peds. Over here the compulsory part is over and then we have just 2 stations left. which are ophthalmology station and ENT station. So, what is the pass percentage for NEB2?
Now we have 50%. We have come 50.
NEB1 is 50%, NEB2 is 70%. You have to pass 14 case stations out of 20. And the compulsory stations are surgery and medicine. And after that, 2 gynae and 2 peds. So, from 20 stations, how much you have to pass to in order to complete your part 2? 14 stations out of 20. Then you will reach the 70% mark. And in our country, usually the criteria are changing, so you have to stay updated till the last moment. So I'm talking about the current scenario, and I'll let you know when they are changing, because in the current time they are having meetings, and NLE or NEB is getting towards ease.
What is the pass percentage of NEB2?
NEB2, sir.
Pass percentage means not the
70.
criteria. How many percent people students are passing?
NEB2 is, sir, mostly almost 80% pass, but in NEB1 or NLE1 mostly fail because due to the basic knowledge. Because NLE2 is related, if your basic knowledge is strong enough, clinical is strong enough, it's passed, because they are not oriented that you should diagnose. Diagnosis is not important, but if you are examining the patient in a proper manner and working on the patient, like if there are certain criteria for certain diseases, like mental score for appendicitis, if you are carrying accordingly, then you will definitely pass.
Approach to the patient.
Approach to the patient is really important. And then things which cause the OSCEs to fail, or step 2 the stations to fail: lack of failure in communication. If you are snubbed, or you have lack of self confidence, it's a really big factor to fail OSCEs or NLE part 2. And then the time management. Most important is the time management. You have 3 hours to complete 20 stations, and every station has different time. You have to read the time at the door. If you forget the time limit, it's like if you are it's in your mind that you have 15 minutes, and 15 minutes was for gynae station, and in peds they gave you 10 minutes, and you are according, so you have to read the instructions accordingly. If they are if there you are not allowed to use any instrument or material, you have to read the instructions, because if you they paralyze you immediately if you don't follow the instructions. And time limit is a main factor due to which mostly OSCEs or NLE2 is failed.
So 3 hours, 20 stations is not even 1 hour means 10
Yes.
minutes. If we divide by 10 minutes, it's like 6 stations. So for 20 stations, you don't even have 10 minutes. It's like 9 minutes
Yes.
for one station. Yes?
Then another main reason for failing the part 2 exam is to unable to complete the documentation on time. If you are writing long notes like complete history, then it will you'll not be that precise, and you'll not get complete information, and most of your information will be missed. So be precise and prepare. Try to prepare precise and complete things, so that you can complete all your data or information in time. And then, most important, mostly physicians are failed because they don't perform hand hygiene. Mostly physicians are failed because they don't perform hand hygiene, because it's a concept that if you are approaching to a patient of febrile seizures, for example, and he's 5 to 6 or maybe younger, so if you are not sterilized properly, you will give hundreds of germs to the patient as a gift. So this error is not accepted in part 2. And then failure to summarize. Usually we see sir ask us to summarize at the end. So if you don't summarize what you say in NEB2 or OSCEs, so you are there you are removed from the OSCE station. because this is the error that is most common. Thank you, everyone. If you have anything else, you can ask.
Thank you so much. This was the reason we were